Welcome to Group 8's Security Case Study, Healthcare Data Breach. On December 24, 2018, a California medical billing management company by the name of Doctors Management Service, or DMS, found the breach in their computer network that exposed confidential patient information including social security numbers, dates of birth, names, and more of over 206,000 patients throughout over 40 medical facilities. The cause of the breach was found to be a ransomware attack known as GandCrab. According to the notice of breach put out by DMS, they were able to restore their systems to a backup in order to combat the ransom and free up their records again without having to pay the ransom. They also stated in their investigation that they could not determine if the information had been viewed or downloaded, but they were not ruling that out as a possibility. The investigation was officially closed on February 15, 2019.
On April 1st, 2017, attackers entered to the system of the Doctor Management Service, or DMS. Without their notice, the malware was hidden until September 24 of 2018, when the attackers encrypted the files and sent a ransom note to the company. Immediately after DSM was made aware of the ransomware, it began an investigation to determine what type of attack they had received and the necessary correction action. The investigation showed that the attack that DMS received was a GandCrab ransomware, which encrypted confidential patient information, including social security number, birth date, names, address, driver license, medical information, insurance, Medicare, Medicaid information, and the attacker sent a ransom note which DMS did not pay because they have a backup of all their files. According to the investigation, the malware was able to enter to the company system through a remote desktop protocol in a company workstation within the billing provider of DMS, as well as 40 other providers included in the network. The way in which the malware entered the system is supposed to be through a spam email and sequentially hidden in the servers. The initial infection occurred on April 1st, 2017. It went undetected for over a year and a half until it was discovered on September 24, 2018. DMS did not pay the ransom since the maintenance of the backup of all its files, which allowed them to restore the information. The investigation could not determine if the attacker used the information affected, downloaded, or filtered into any patient data. Once the type of the attack and the information that was affected was determined, DMS notified the people that may have been affected, and also review all and identify any personal information on the affected server in order to ensure the integrity and privacy of the client. Despite the fact that malware entered the system in 2017, it was not until 2018 that DMS was made aware of the attack, revealing the flag in its security system. After this attack, DMS improved its security network, making change in its security system by limiting access to the system from outside to the network. To prevent any attack in the future, DMS is working together with information security experts, in addition to helping identify new types of attack and be alert to the new threat. One of the most important things that DMS was implementing to avoid the new attacks is to train the staff in what is referred to as cybersecurity, to have a good practice when they're using their computer and the information they receive in their emails. As part of the obligation and responsibility of all companies that provide health service, DMS notified this incident to the U.S. Department of Health and Human Services. The investigation was closed in February 2019, which left the client unaware of the information released that was viewed or downloaded.
Next, we're going to evaluate the breach. What happened? The breach that affected DMS is known as GandCrab ransomware. This particular ransomware was first discovered in early 2018 and was the most widespread ransomware used that year. GandCrab is spread via email and is housed within a zip file attached to that email. When the victim opens the email and then the attached file, the ransomware is automatically downloaded and the victim's workstation is compromised and the code is executed. Someone within the organization opened an email and the enclosed file without knowing it was malicious, and that enabled the infection to spread throughout the entire computer network, lock down everything, and inform DMS that if they wanted their information back, they would need to pay the allotted amount, then their information would be released. The problem with this is that in most cases, the company will pay the money, but the attackers will not release the information, so they now have the money and the confidential information they stole to sell on the black market for even more money. Luckily for DMS, their system had been backed up just prior to the ransomware infection, so they were able to restore everything from a backup and no information was lost on their end and no money was paid to the threat actors. One of the most important things that they could not confirm or rule out was that if the information that was ransomed by the threat actors had been viewed or downloaded and stolen from their servers. Because there were no definitive evidence that proved the information never got into the wrong hands, DMS was warning patients to actively monitor their information and look for signs of fraudulent behavior and identity theft. If patients had been subject to fraudulent behavior, DMS is encouraging them to contact law enforcement immediately and report it. They have also set up hotlines for patients to contact DMS with any questions, concerns, or problems they may have as a result of this breach, and they will work with the patients to resolve the issues.
This attack could have been prevented, or the company could have minimized the exposure of records by following similar protocols that have been implemented in medical companies in the previous years. DMS had enacted more stringent security policies only after the fact. Medical companies have been a prime target for many threat actors due to the information they contain on clients and general lack of unity throughout the structure of securities within the field. The first recommendation DMS should have acted on is its employee education. It has been far too easy in the past to be able to call a company and impersonate a victim in order to gain access to more information. Many employees have also been the victims of targeted phishing attacks in order to infect local networks with malware and backdoors. Had DMS educated their staff more effectively, the email that was sent could have been filtered by the employee. The employee should undergo extensive training in security and become knowledgeable in the latest ways threat actors are targeting companies. Employee negligence is the main cause of data breaches. According to the State of the Industry report by Shred-it, an information security company, the report found that 47% of business leaders said human errors such as accidental loss of a device or document by an employee had caused a data breach at their organization. Each employee should attend and complete a security awareness training. Another recommendation for DMS would be installing better network security, firewalls, and extensive email scanners. Had the company installed defensive measures prior to the attack, it could have been completely avoided. DMS should install higher levels of security that will scan every email and link for potential threats. There should be a whitelist for known good contacts, and every new contact must undergo security scrutiny to become whitelisted. Finally, DMS should focus their attention on any vulnerabilities within their framework. They should update any outdated version of their server operating system and of any local desktops. The routers and access points should have abilities to fend off any sort of AP injection from threat actors within the vicinity. The network traffic should be routed through a virtual private network to scramble their traffic and prevent the possible DNS and DDoS attacks. To wrap up, the unforeseen attacks on doctors' management services was preventable. However, in light of the discovery of GandCrab breaching the system, DMS's response truly did solve the vulnerabilities within their control. They patched the network, advised those affected, restored the systems through backups, and trained staff in cybersecurity. The detection deficit could have been lower, and the staff should have been more prepared. With the closure of the investigation, DMS created a better environment in handling and preventing network attacks and data loss. Thanks for watching.